And Frank, we've got a great show lined up for you today, talking with Dr. Vitarello. He is the chief cardiologist at FMH and also president of the Cardiologist Association.
Medical Society.
How you doing, doctor?
I'm doing wonderful. Thank you for inviting me.
And healthcare is a big issue. Walter, when he filled in for me on Monday, it was most of the discussion. But we wanted to get someone in here and talk about all the facts and talk about why in the world this movement of reform has started and what really needs to be reformed. From the perspective of a physician, and this is probably a topic that you have watched very closely.
Absolutely. I've been following this for the last 3 years, actually. This was something that was with us for many years, and it's come to the point where the American public, our society has to make a decision on how to maintain our excellent care here in the United States. And if you look at the healthcare system, you have to look at it as a disease, a patient. So think of the United States as a patient, and we have to identify what the diagnosis is. Like if you had a heart attack, I'm a cardiologist. Well, we have a healthcare system that's not 100% healthy at this point. The patient isn't dying, our country isn't dying. No one's being denied emergency medical care, but it is ill. Now, the second thing is, as a doctor or as a voter, you need to figure out, how can you help that patient? How can you help this medical system not only survive, but grow, but keep costs at a reasonable level that we all can afford health care? Then the last thing I always taught my medical students is how you, as a civilian, a citizen of this country, how can you do something to ruin it and hurt the patient? And we need to talk about some of the political shenanigans that are going on right now that will definitely hurt the patients. The most important thing that we need to talk about today is not my pocketbook and what the pharmaceuticals make, et cetera, but what's best for the Frederick patients and the rest of our patients in the United States. And that's what I think Blaine and I were going to focus on,
Sure.
This anatomy of a disaster that's coming up and how we can fix it.
Can we at least make some type of an assessment of the healthcare system in America? Does it have major problems? Where does it compare against the rest of the world? Do we have one of the best? Do we have a mediocre? Is it in the middle?
Yeah. Well, let me explain it. And as a physician's point of view and being a patient myself, we are the elite of the elite. We have the best healthcare system in the world.
So we do.
We absolutely do. Now, I tell you, and how they judge us is very unfair. First, you have to look on how they make comparisons, what they do, and it's a statistical trick, and how it works. Let me go over this with you. What is the American public? Who is it? Well, let me tell you who it is. It's German, Irish, Italian Americans, it's African American, it's Asians, it's legal or illegal immigrants, it's people from South America, Central America, Canada. We have these people living in our society, in our country, so the United States is not really America anymore, North America. It is really the world that's contained in this large landmass, and we're treating all kinds of people that have diseases from their native countries that they bring here now, like tuberculosis, malaria, AIDS, things that we've never seen before, rheumatic heart disease. And then they compare us to, watch this, Switzerland, lily-white Switzerland. Everyone is Swiss there, blue eyes and blonde hair. So you can't take an homogeneous society like Switzerland or Germany and then compare it to the United States that has all these different people in it. And I want to talk about, for instance, this is how government officials kind of lie to us and statisticians. There was a recent article in the Washington Post yesterday, and they said, let's compare La Crosse, Wisconsin, 60,000 people, to Miami, Florida, and see why our healthcare fails us. Because in Miami, the cost of spending there is twice as much as La Crosse, Wisconsin.
Sure.
Well, you say, wow, that's horrible. Why are they spending all that extra money? Are the doctors crooks there? Well, let me explain. Well, let's go over this real quick. In La Crosse, Wisconsin, there are only 1.1% African Americans, and there's 1.2% Latinos. Now, when we study medicine, poor people get less care. And that's wrong. And as physicians, we want the best of care for Latinos, the best of care for African Americans. But if you compare it to Miami, which is the third most impoverished city in the United States by American Catholic Charities, there are 66% Latinos and 23% African Americans, all right? And there's a whole polyglot population of immigrants that don't have citizenship who are residing in that city of 300,000 plus. So how can you compare the outcomes and expenditures with people from Ecuador, rheumatic heart disease, that come over and get surgery for $40,000 because rheumatic heart disease doesn't exist in Lily White, La Crosse, Wisconsin. So don't compare apples to pears. That's the wrong way of trying to teach the American public. Compare Lily White, La Crosse, Wisconsin with Lucerne, Switzerland. And you'd be very happy to see that in Wisconsin, they get some of the best outcomes in the United States. So you have to make valid comparisons. And that's where I'm glad, Blaine, you got me here to do this, because I've been anxious about this for many years, because I've known the facts. I know exactly what happens with patients. We are now involved in a political debate. And unfortunately, when you have a political debate, the science goes away. And that's where guys like you have to sort through the facts and ask the right questions and say, what's the facts, doctor? Can you show me what's wrong with your system as a doctor and what's right? And that's what I'm here for. So, again, we have...
Would we agree that there is some reform needed?
Absolutely, yeah.
Okay, so we can agree on that.
Absolutely.
And if you're just tuning in, talking about healthcare, talking to Dr. Vitarello, Chief of Cardiology at Frederick Memorial Hospital. We're going to be going through a presentation today, but of course phone calls are always open if you have a question for Dr. Vitarello, 301-694-WFMD. Can we at least identify the uninsured patients? Because there's a lot of numbers that are being thrown around. And what's the real number? And are people really denied care?
Okay, let's first start off denied care.
Okay.
In the United States and its territories, you cannot be denied medical care for an emergency.
Okay.
It is illegal. If you did that, let's use cardiology again. You came to my hospital uninsured and you're from El Salvador. If I did not treat you with an emergency angioplasty, not only would I be sued, number one, two, I'd be kicked off staff, I would face civil penalties and go to jail. It is a federal law. You can't do that. That is a myth.
So with emergency care, you cannot be denied.
Absolutely.
That's a myth. Okay.
It's a total myth.
It's a law. You must treat that patient.
Absolutely. And that's where the politicians are going off. We have to pass this by August, even though you didn't read the bill, anyone out there in Congress, because 14,000 people a week are losing their health insurance. Well, the question is anyone dying as a result of that? For emergency, the answer is no. N-O. We do this. We treat these people. We don't. I personally, my group does not have collection agencies, but there is no crisis for emergency medical care. You will get it. Now, your big question was, how many people really out there in our public don't have health insurance? As you know, they use a common number of 47 million people. Mm-hmm. But let's break down that to the anatomy again. Let's use my patient. Let's look at the anatomy. Let's look at the chin bone here for a second. Okay. 25% or 22% of that 47 million, almost 9 million, are college students, ages 18 to 21. They're pretty much, they think they're immortal. Yep. They're young. When was the last time you seen a college student had a heart catheterization? Nil, ever. But they choose not to get health insurance to save money. That is something they personally do not want, or their parents won't pay for. So they come from families with incomes, but they choose not to. The second thing is, the other group of 25% of these people are illegal immigrants. They're not citizens of our country, but they're thrown into the pool. So
they're
really,
that number.
Absolutely.
Okay.
And I'll tell you something very interesting. The new bill that came out yesterday, the Democrats, and I'm a blue dog Democrat. Don't get me wrong here, Blaine. I'm trying to stay in the middle here, okay. And I'm trying to see where virtue really lies in the middle. What they're saying right now is that this new health bill, they're going to insure everyone, but Pelosi says they will be an American citizen. But they took out of the bill any verification when you get your health insurance. So if you apply, they won't ask you for any verification. So in reality, they're going to open this up to everyone. And I don't think the United States right now should be the primary care provider for El Salvador, South America, South Africa. Yeah. We will help emergencies, but we should not bear that. Now,
they're speaking the language everyone wants to hear, but they're leaving the loophole in the bill.
The loophole's there. So basically, if you want to get insurance and you're from another country, you're going to get it because no one's going to verify you. And that, to me, I think is somewhat is wrong, disingenuous, especially in a recession. Our economy is tanking right now. We're trying to save our nation by doing a lot of things.
But these folks have emergency care right now because they can't, all the folks we're talking about can't be denied on emergency care anyway because of the law that's in place.
Absolutely not. And let me go a step further, Blaine. We have the Mission of Mercy, and we provide free medical care to all Latinos here.